morning, ladies and gentlemen. Thank you for coming and braving the traffic this morning. I believe everybody was stuck in jam. And we're really excited to be presenting 15 years of evidence to you in an hour, of course. I'm not going to do a very good job of it, I can assure you that. But what we're going to be doing is at least picking up some of the key findings from the different thematic areas and present them to you. The country report will be released, which has a lot more evidence. We've really taken evidence from over 200 papers that were written in India and 800 papers overall in the Young Life study these 15 years, which covered the other countries as well, and many papers which covered all 4 countries. So I think this is really a bit of a synthesis. The country report didn't do any fresh analysis. It was more a synthesis of what was already done over these 15 years. So what is the developmental cascade that we are seeing? If there is growth stunting in early childhood, if there's poor health, if there's compromised cognitive psychosocial development, there will be poor developmental outcomes in the early years. This, in turn, in the middle childhood, if you have weak literacy skills, so you have these added, you see the cascade, it's just adding to the disadvantage. Then you have weak literacy skills, even if you are in school, poor health, low aspirations, leading to poor cognitive, physical, and psychosocial development. In early adolescence, again, if you have poor health, educational, psychosocial outcomes, and low aspirations, you're at growing risk of school dropout. And late adolescence, again, limited life skills, poor reproductive health. Many of the girls would be married by now, poor job prospects. And when you transition to adulthood, you have limited ability to sustain the family, low psychosocial well-being, often depression and other things have come in, and poor quality of life. And of course, everything is triggered by the household context and the policy institutional context, because you cannot see this within individual factors alone. So you need to look at how is overall food insecurity affecting the family stress, shocks, deaths. Also look at access to social protection, weak basic services, limited opportunities to learn and progress in school, poor public health services. If this is the negative cascade, you will have an intergenerational transmission of poverty happening. But on the other hand, I think what we need to do is provide an enabling and protective environment across childhood, because we've got to find solutions. Reduce household poverty by providing social protection to the most marginalized. Look for, strong basic services, especially water sanitation. I think we must have complete health care coverage, which is, I think, now in the offing. Can we reduce violence? Can we provide safe learning environments and safe communities and households to children? And give them inclusive and gender equitable values and social norms. Because if we don't do this, the children are not making successful transitions to childhood, and we are perpetuating the cycle of poverty. So let's pay attention to the accumulation and maintenance of human capital over the life course. I think we are divided into departments and sectors, even within the programs we run. How can we look at the accumulation and maintenance of human capital over the life course? Can we recognize multidimensional childhood poverty with a focus on marginalized groups? Prioritize investment in early years. I think that's so evident from the data. Attention to quality of education and school experiences. Skill development, and I'm not, I haven't presented the data on skill development, but Dr. Reddy will. Our children at 22, those who went into ITIs are earning much more than the ones who even went for graduation. So I think we need to have some lessons learned. Focus on building aspirations of children and parents within programmatic interventions, and recognize adolescence as an under-recognized second critical window. I think we just don't do enough for adolescents, and there is a great need to focus on them. And of course, if we don't address this persisting social norms and expectations and don't prevent child marriages, we are not going to move forward. Children felt they were part of a change that has happened. Thank you very much.